Hi, I'm Dr. Roadhouse, and I want to introduce you to our patient, Linda Bradshaw. Linda is in our thyroid program. She's been in the program for about 2 months now, and why don't we first talk about the symptoms that you had before you came in to see us?
I just had really bad neck pain, nausea, couldn't swallow. Actually, was choking when I would eat.
Okay.
So couldn't sleep. So it was
Okay.
starting to affect my whole life.
Okay. And go back and talk about the nausea. Okay.
Well, the nausea, with I guess the information that was in my neck that didn't help me understand what was going on. But the nausea was every day for 3 years, and I never got an answer. Doctors to give me, prescription or meclizine over the counter, which I would take every day. To the point I just said it wasn't doing any good. That I just would deal with it.
Okay. So was it all day?
It'd be all day.
Okay, so you'd
day.
wake up with it,
Wake up
you were
with
nauseous, and then went all day. Okay,
Mm-hmm.
and then talk a little bit about, the throat, because it was affecting your swallowing, and then kind of talk about some of the doctors you went to and the tests that they did on that,
Yeah.
or what their answers were.
Yeah, I just, the first sign for me was the swelling around my neck area, and then the swallowing. And I started in bad headaches, and I started going to the doctor, and they did MRIs, CTs, and they kept telling me, that they couldn't find anything really that was significant. I had a small bulging disc, but it shouldn't be causing that kind of pain. So they all wanted to write prescriptions. I went to numerous, I've lost count, eight or 10 different doctors. They all just wanted to do prescriptions, send me home, or antidepressant pills because I basically putting a Band-Aid, but I never got answers. My body was telling me there's something not right, and I knew that, but I was getting no answers to help rectify that, to help me feel better. So I just, at one point I had just gave up, quit searching, until my husband saw you on the website and said we've got to continue because I really had no quality of life. I basically got up, did my job, and went home. And I had no energy. I didn't want to do anything. So I really had no quality of life until I started this program. So you lose hope after a while. But, I never got any answers as to why those inflammation are swelling. And really, even with the doctors, I never really got the feeling that they really cared why there was inflammation to begin with. Anti-inflammatory pills, pain pills, that was the answer, and antidepressants, which none worked.
Yeah.
So,
Well, what about, had anyone ever done any blood work on you?
well, I've had hyperthyroidism for 14 years. Okay, so every 6 months to a year they would do TSH levels, but nothing beyond that. Just basic CBC. My basic
And then they
test,
just gave
that
you
was
the medicine,
it.
right?
Yeah, there was no extensive blood work ever done. So they would always increase my thyroid medicine a little bit more, but nothing beyond that.
Yeah, and you still had all the symptoms, the medicine didn't work, so they kept upping it on you.
Right.
Okay, so then we came in and, once we, did the screening process and found that you were a candidate, and we did the lab work. And the labs, we tell everybody, they're the best labs in the world, and if you haven't had these labs done, you haven't been properly tested. And that's where we found out we do 9 tests on the thyroid. We found all these other parts, or labs on the thyroid that weren't working right. So we started doing that. But, as far as, your overall symptoms that you had, talk about where you're at now in just 2 months, which is...
In just 2 months, I have great decrease in nausea. I had a little touch of it Saturday, and before that it had been weeks. And it's amazing to wake up after you have had that for so long, to wake up and not have nausea, and you're going through your day like, I have no nausea today. And it makes you feel overall your well-being, you're better, feel better.
What about the headaches?
The headaches have lessened.
Okay. What about the neck pain?
The neck pain has decreased. I still, have some, but it's my biggest notice has been in my side, so I can swallow.
Okay.
I haven't choked on my food in quite some time, so And that's less embarrassing when I'm eating with my family and not choking, so that's nice. So yeah, I already see difference, and you know, when I found this program, my husband and I, it gave me hope, and now I'm like, okay, wow, you know, I'm actually starting to feel better, so I'm excited, and I don't just go home after work now, I have energy, and you warned me in the beginning not to overdo it, but it's hard to do when you have felt bad for so long, and then you feel good.
Yeah.
Because I wanted to get out there and garden, and I did exactly what I said not to, and kind of paid a price for it the next day, but I still have so much energy when I get home at 5.
Yeah.
It's
And the
amazing.
other thing is, you know, like you would have never dreamed of doing that stuff before, but even when you overdid it, it just took a day or
just
two,
took a
and then
day.
you were back
Yeah.
doing good again.
Yeah.
And then, okay, so anyway, you know, you've been in the program for 2 months, and so you're already seeing results. And so, what about all the stomach stuff and all that? How's that doing now?
Well, I had GERD, I had acid reflux quite a bit, and I see some decrease in that too. I'm hoping to wean myself off of the Prilosec, but I'm instead of every day, I'm doing every other day on the Prilosec,
Okay.
and I'm doing really well on it.
Okay.
Doing that, so I do see a decrease in the acid, but that nausea has been the biggest thing for me, not to have experience in
Okay.
that.
Good. All right, so we'll check back in with you in a couple months. Obviously, she's had great improvement, and you know, after we did the lab work and figured out what was going on with her, you can see she's starting to have improvement where all the other doctors couldn't help. We just have a different approach. The labs, you know, I mean,
Amazing.
yeah, and you'd never see anything like that. And if we'd have done the same lab work that all the other doctors did, we would have had the same results that they had. So you're on your way right now. We'll check back in with you in about a couple of months, okay? All right, thanks.